Hello and welcome back to Unacademy. Myself, Dr. Muskan Chaudhary, and we will today cover the questions that has been asked in the nation. We'll cover the previously yearly asked questions on in the Central Institutes. All right. So starting with Unacademy, we know that Unacademy is one of the best platform that is available and to prepare for any of the competitive exams, and we can have both the live and the recorded sessions, mainly beneficial for those students who are doing the JR shifts and have joined the hospitals, and they have limited period of the time for themselves to get the live sessions so they can watch the recorded sessions. Learning from the India's topmost educators for all the medical exams, be it NEET PG or NEET UG, and if, whatever exam you name it, Unacademy has the best of educators on this platform who are working day and night to help you evaluate your preparation and to analyze your preparation. Now compete in the live T&Ds that is being provided by the Unacademy, where you can enhance your performance and can analyze your performance and where you stand out along with 25,000 MCQs. That is a huge bunch of MCQs that is being available on the Unacademy platform, and do use my code that is Muskan10 to get 10% of the discount on the NEET PG subscriptions. All right. Uh, Icon subscription something where the prep leader has collaborated along with the Unacademy. We get the clinical and the integrated essentials, the video lectures from the prep leader with the QBanks and the rapid revision notes. The rapid revision notes of the prep leader are very famous and they are very useful, specifically when you want to revise the topic within short period of span just before the examination with the well-structured live batches, recorded sessions, Q banks, competitive quizzes, and the printed and the digital notes. Batches are starting from the 6th of the October and mainly focusing on the FMG batches, where you can focus on the structured 2 month preparation for the FMG December 2021 through the topic wise coverage. Mission INICT, which is aimed for providing 1 month revision of all the 19 subjects. Target NEET PG 2022, where we get 6 month coverage for all the 19 subjects along with the clinical cases discussions and the instruments specifically aimed for the fourth year profession examination students to provide the clinical knowledge. All right, with the live interactive educations with the top educators, recorded versions, GTs, TNDs, PDF notes, and the clinical approach for the topics that we are reading, and the structured batches for all the exam that is required. Now, raise a hand feature that is specifically being provided by the Unacademy on its platform, where actually you can raise your hand and ask your doubts and the queries and just let us know what is the problem that you are facing with the personalized and highly interactive live classes, and educators can drive the engagement with the quizzes, videos, vivas, and the doubt solving sessions, which enables the interactive and the fast doubt solving with an option to have discussion, one-on-one discussion in the live class. You can boost your medical PG prep with the Unacademy, where with 12 month you get 2 month subscriptions totally free, and with 24 month you get 4 month subscription totally free, and four subscriptions mainly for students second and third year. They can just have the iconic and the plus subscriptions for 4 year just to clear out your basics from the starting. Now these are the packages for the NEET P subscriptions for the iconic and the plus subscriptions. When we amount for the 1 month, it is very less compared to other coaching platforms. For 1 year there has been price hike. For 1 year it is around 52,500. For 18 months it is around 57,500. For 2 years it is around um, 55,000, and for 36 months it is around 75K, and for 4 years it is around 85K. Please do use my code that is Muskan10 to get 10% of the discount, and please do subscribe and do like share the videos. All right, so for starting with the first question, I'll give you around 30 seconds which will be enough for you guys because the questions are lengthy, mostly from the central institutes. So 30 seconds for the every question, and just let me know the answer for that. Okay. Chalo, starting with the first question. A 35-year-old A 35-year-old male farmer presents with multiple discharging cervical sinus. Which of these stains will be useful for the diagnosis, and where does the organism colonize on in the body? So what we are talking about now, the key points that we can get from the this question. The first is that a 35-year-old farmer, that we are talking about the farmer that is presenting with the discharging sinus, discharging cervical sinus, discharging cervical sinus. Now, which of the following stains is useful for the diagnosis, and where does the organism colonize in the body? Now, when we talk about the farmer and the discharging sinus, either mycetoma should be coming to the mind. Kyuki mycetomy, when we read about the mycetoma, which is also greatly known as the Madura foot, is mainly because of actinomyces and because of the U mycetoma. All right, and where it is mainly colonized? It mainly colonized in the oral cavity, in the neck region, in the cervical region, and where it presents with mainly the sinuses. All right, so mouth is the common area of the colonization, and the stain that we are using what is acid fast AFB in the farmers who are present with multiple discharging cervical sinus. The most likely diagnosis is what? Actinomyces. All right. Now, actinomyces, they are what very important to remember that they are not acid fast, and we just read the difference between the nocardia and the actinomyces. We read that nocardia is what? Acid fast, and actinomyces is what? It is non-acid fast. Very important, and it occurs most commonly at the oral, cervical, or the facial sites, usually as a soft tissue swelling, abscess, and the mass lesion that is often mistaken for the neoplasm. The angle of the jaw is generally involved, but a diagnosis of the actinomyces should be considered with any mass lesion with the relapsing infection in the head and the neck. All right. So when we talk mycetoma or the Madura foot, it is mainly what? Traumatic inflammation in the skin. All right. And mainly cause what? Chronic granulomatous disease that is characterized by the swelling of the tissue, discharging sinuses, and pus with granules. Pus with granules. All right. And it is of two types. As I told you, it is of two types, whether it be of actinomyces or that is actinomycetoma or eumycetoma. Okay. Now, there's some basic difference between the actino and eumycetoma. Okay. Now, in actinomycetoma, we actually have the multiple sinuses, and the organisms are mainly the gram positive. All right, here they have the single sinus discharge. Here the discharge is mainly what? Is mainly what? Purulent. And here it is what? Zero NGs discharge with inflammation. The purulent discharge is mainly with greater inflammation is seen where in actinomycetoma. In the use mycetoma, the inflammation is less when compared this with the actinomycetoma. All right. Mainly the response, this is important to remember that response to treatment is good. All right. So it has what? It has what? Good prognosis, that response is good. Mainly what we have to do, mainly we have to amputate the limb agar if the like the mother of foot the limb is involved, so we have to do the amputation. All right, so when we talk about the difference about the eumycetoma and the actinomycetoma, as I told you, actinomycetoma is mainly by the gram positive bacteria, is mainly by the gram positive bacteria with no clear margins, and as I told you, it has many purulent discharge, sinus discharge compared to that of the eumycetoma. All right. Now, the color, when we talk about the color of the grains, the eumycetoma mainly present with white or black colored granules, and here it has different color but not black colored granules, and it is mainly what? Inflammatory with rapid progression. It is slowly progressive, and the bony invasion takes place after a long time, while in actinomycetoma everything is fast, is gram positive with no clear margins of the lesion that is taking place, and many sinus discharge with different colors of the granules that will be released, and it is mainly showing the inflammatory and rapid progression to the bone. Now, talking about the management, main management in the eumycetoma is what? Amputation. And the response of the treatment of the actinomycetoma is what? Good. This mycetoma that is caused by the microaerophilic actinomyces is termed as actinomycetoma, and caused by the true fungus is what? Eumycetoma. All right. Also remember, in actinomycosis, we see what? Splendor papillary reaction. And this is what? This is the granules this is the granules that are consisting of the mass of the gram positive bacteria that we are talking about, and it is consisting of the boundary with configuration of the granules consisting of the eosinophilic amorphous material, showing the reaction known as the Splendor Hopley reaction in that of the actinomycosis. Mainly the question that we're talking about, the cervical discharge, that is the cervical discharge, and mainly at the angle of the jaw, that is a cervical discharge mainly at the angle of jaw, that is discharging granules. Alright, this is the most common and recognized presentation. This is the most common and the recognized presentation of the disease. And the species are commonly in higher concentration in the tonsillar crypts and the gingiodental surfaces. Many patients have a history of poor dental hygiene, oral surgery, or dental procedures, or trauma to the oral cavity. Chronic or tonsillitis, mastoiditis, and otitis are the important risk factor for actinomycosis. So, what we need to remember that the cervical discharging granules is the most common presentation, and mainly at the angle of the jaws where you can see the purulent discharge. And mycetoma is of two types. One is the actinomycetoma and the eumycetoma. Actinomycetoma is due to what? Mainly by the gram positive bacteria. And the eumycetoma is mainly by the fungus. Now, when we talk about the laboratory diagnosis, we need to remember that it shows the sun ray appearance. It shows the sun rays appearance, and it is due to the granules that it is showing the sun ray appearance. And They are what? They are just we talked about. They are what? Gram positive filamentous bacilli. All right. So they are gram-positive filamentous bacilli, and using the H2SO4 stain that is known as what the Kenyon stain that we also use for the mycobacteria as well as for the nocardia and the actinomyces. That is what. Now, coming to the next question, a patient comes to your clinic with a complaint of multiple episodes of loose, watery stools for 3 days. On probing, you discover that these episodes start after he had ingested the shellfish at a local restaurant 3 days back. Other people who had food from that restaurant had similar symptoms. What is the most common cause of the viral diarrhea in the adults? That is a calcivirus, rotavirus, adenovirus, or the norovirus. Different colors of So now coming to the options one by one, the question is saying that patient comes to a clinic with the complaint of multiple episodes of. First point is what we are talking about: loose watery stools. Okay, and that too for 3 days. Another is that these started after he had the food at a local restaurant and he ingested shellfish. It is important to remember that he is talking about the history that he had consumed the shellfish 3 days back, and other people from the same restaurant also had the similar symptoms. Now, just after having the food, they are having the symptoms of acute viral gastroenteritis. We are talking about acute viral gastroenteritis. ठीक है. Now calcivirus is mainly affects the cat. It doesn't affect the human. So this we can rule out the options. Now comes the rotavirus, adenovirus, and the norovirus. All can cause the acute viral gastroenteritis. But the question that is main pointing is that he consumed the shellfish, and that when clinical history में ऐसे अपन पढ़ते हैं कि when we talk about the pastry and that meat products and poultry products and all, we are talking about the food poisoning that is by the staff. So similarly, when we are talking about the person has consumed the shellfish, we are talking about the norovirus. We are talking about the norovirus. That history of multiple episodes of loose watery stools for 3 days and the history of ingestion of the shellfish is suggestive of acute viral gastroenteritis, and most likely organism is what? Norovirus. Very important. All these are aims previously asked questions. And what is the most common infectious agents of the mild gastroenteritis in the community and affect all the age groups? It affects all the age groups, whereas sapovirus is primarily affecting in the children. Since we know that the rotavirus is mainly affecting in children, so one option can be ruled out from this point as well, that we are talking about what we are talking about adult person. And the main clinical point that we need to remember, the history point, that he has consumed what? The shellfish. All right, so it is causing what? Epidemic gastroenteritis that is replicating the human intestinal cells, and it is not able to grow culturally normally. And what is seen, we have seen the genetically variable strains. Now norovirus, the patient start presenting the symptoms just within 1 and 2 days, and incubation period is what? 1 to 2 days, either mild or abrupt. Okay, so patient will present with the symptoms of the gastroenteritis, that is the vomiting, diarrhea, all right, headache, myalgia with low grade fever. Most cats recover completely after calcivirus infections, but but rare strains can be specifically deadly. The viruses, they human strain has not yet been seen, and therefore, please remember the calcivirus. We are not counting that into the answer. Now, rotavirus. One thing we need to remember that they are what they are wheel-shaped virus. That is rotavirus. Having a double-stranded segmented RNA virus. When we talk about the virus, we'll just remember the mnemonic, and we also have covered the mnemonic in one session that is covering the segmented viruses, RNA, and the DNA viruses. Remember that structure, that is what wheel-like. Now, the most common cause of the acute gastroenteritis, but where, in which age group? In the infants and the toddlers. This we know that we are talking about the rotavirus because we occasionally read about the rotavirus in PSM as well. So, from the questions, just point out the age of the patient and to the clinical history that he has consumed shellfish at the restaurant. The peak season is what the cooler fall and the winter months, and the incidence is what where 3 to 24 months with the incubation period of 2 to 3 days. But the most important is the age group that we are talking about. Patient will also present with a history of what fever and the watery diarrhea. Talking about what adenovirus. What is the most common presentation that we see for the adenovirus in the ophthalmology that we read is causes what? Epidemic keratoconjunctivitis. Epidemic keratoconjunctivitis. This is again an important question from the ophthalmology point of view. Please remember this that adenovirus causes what? Epidemic keratoconjunctivitis. Apart from this, it also causes the acute follicular conjunctivitis and pharyngoconjunctival fever. Now, these are the clinical manifestations mainly. That is, it also causes a gastroenteritis, but the most common if the patient present what is what EKC, all right, and pharyngitis, pneumonia, and cystitis. Now, coming to the next question, the antibody dependent enhancement is implicated in the immunopathogenesis of which disease? Influenza, Staphylococcus toxic shock syndrome, Waterhouse Friderichsen syndrome, and dengue hemorrhagic fever. So what is the answer? What we're talking about the antibody dependent enhancement. Now, when we studied about the staph toxic shock syndrome and the Waterhouse Friderichsen syndrome, very important is the complication of किसका complication है? It is the complication of Neisseria. लेकिन कौन से निजीरिया मेनिनकोकस और गोनोरिया भी रिमेंबर डब्ल्यू को उल्टा करेंगे तो एम इट इज द कॉम्प्लिकेशन ऑफ निजीरिया मेनिंगोकोकाई ठीक है एंड इट इज व्हाट इट इज द बायलेटरल एड्रिनल ग्लैंड हेमरेज ठीक है इट इज अ कॉम्प्लिकेशन ऑफ निजीरिया मेनिंजाइटिस एंड निजीरिया गोनोरिया क्या कॉम्प्लिकेशन था इट वाज फिट्स हर्कर्टिस सिंड्रोम नाउ एंटीबॉडी डिपेंडेंट एनहेंसमेंट वी आर टॉकिंग about in the staphylococcal toxic shock syndrome it was not due to the antibody it was due to of the toxin that is being produced by the staph the various type of toxins that we saw in that staph and in the Neisseria that is a gram negative और हमने पढ़ा जहाँ पे gram negative है they will have what outer membrane will produce endotoxin all right so These two options and the influenza, it is not because of the antibody dependent enhancement that is showing the pathogenesis. It is seen in the dengue hemorrhagic fever. What happens in the dengue, जब कोई नया strain से infection होता है, or when new viral infections takes place, the antibody, instead of neutralizing the virus, get attached with that of the virus, so it doesn't actually neutralize the virus, and that antibody with that virus is taken up by the phagocytic cells, and they are endocytosis se they are engulfed, and this is what they are, what altering the immunity of the person, but it is what the immunity is unable to act against the dengue. Okay, so dengue hemorrhagic fever, antibody dependent enhancement is implicated in the pathogenesis of the DHF. So this is what having when the secondary dengue infection is taking place from the same serotype. All right, the immunity is what capable of acting against the same virus serotype. But what happens when the dengue virus, when we have the different serotype infections, the neutralizing bodies, antibodies that must be neutralizing the virus, instead of neutralizing, they bind with the virus that is taken up by what? Phagocyte, all right, and they replicate inside these cells, leading to what? DHF, DSS, and neurological complications. So remember one point, that antibody dependent immunopathogenesis is seen in what? DHF, DSS, and the neurological complications that we see in the dengue. So the one thing we need to remember is the vector. Vector is what? Is the vector. Life cycle we read again when we cover the dengue in detail, because right now we'll cover the important MCQs that has been asked, and these are mainly the MCQs that were asked in year 15 and the 16. Now the virus infection depends, it is asymptomatic and symptomatic. Symptomatic will go in the DF and the DHF, and depending upon the categories A, B, and C, we'll discuss the treatment that we discussed yesterday as well. Mainly of the three phase, one is the febrile, critical, and the recovery phase. All right, so we'll into detail we'll see it later, that the grade 1, 2, 3, and 4. What we see in the grade 1 is by non-specific symptoms along with the fever. All right, only the hemorrhagic manifestation is positive. In grade 2, we'll see what? Spontaneous bleeding. In the grade 3, we'll see the circulatory failure with hypotension, with the presence of the cold skin and the restlessness, and in the grade 4 we'll see the profound shock with undetectable blood pressure and the pulse. Now, coming to the next question, the phage mediated changes in the corynebacterium diphtheria is due to which of the following? It is due to conjugation, transformation, transduction, or none of the above. So what will be the answer? That phage mediated changes in the corynebacterium diphtheria. Now in the question phage आ गया है, तो phage का तो एक ही तरीका, that is what? That is the transduction. All right, and this is the virus that is inside the bacteria, because bacteria is what? Host for the bacteriophage. All right, so it's not conjugation. Conjugation is what? With the help of the conjugation tube, and it is mainly the transfer of the plasmid from one bacteria to another in those bacteria that is having the TRA genes, because TRA genes is mandatory. Please remember, TRA genes is mandatory for the formation of the conjugation tube. All right, so this is not the answer. Transformation क्या होता है? Transformation is what? It is the directly uptake of DNA or the plasmid factors from that of the environment. ठीक है, from one bacteria to another bacteria. When the bacteria is about to die, it will release its DNA content and the plasmid into the fragments into the environment that will be taken up by the adjacent bacteria only if the bacteria is what competent, that is having what competent factors on the bacteria, only they will be able to take directly uptake of the DNA and the plasmid factors from the environment. So this is also not possible. Transduction is what in the transduction we read about the two cycles. One is the lytic and the lysogenic cycle, and the generalized transduction and the specialized transduction, जहाँ पे only the adjacent bacterial DNA was taken up by the virions that were forming inside the bacteria. So this was transduction, where the bacteriophage changes is taking place and is what helping in the adding another features to the transferring from one bacteria to another bacteria. And all these are what all these are example of horizontal transfer. Now the donor DNA is carried by a phage coat and is transferred into the recipient by the mechanism, and it is a mispackaging because it is not that is was about to be done, but it is mispackaging. That is, the bacteriophage, the daughter virions are carrying the DNA from one bacteria to another bacteria and adding the antibiotic resistance and other features to the bacteria. Now, coming to the next question, the trivalent influenza vaccine contains all of the following strains except H1N1, H3N2, H2N1, and influenza B. तो क्या रहेगा आंसर? The trivalent influenza vaccine contains all of the following strains except. Now it doesn't contains the strain that is H2N1, but it contains the other strains, that is the H1N1, H3N2 of the influenza A virus. Now, and each seasonal virus vaccine contains antigens that is representing either it is what trivalent or it is what quadrivalent influenza vaccine. All right, that is containing one subtype of A strain, that is H1N1, another is H3N2, and another is what influenza B virus strain. ठीक है, so trivalent में is containing one influenza type B virus strain, and if it is quadrivalent then it will contain two influenza B virus strain. But influenza A virus, we need to remember, it is containing what H1N1 and H3N2, but not H2N1. Please remember this. Now, coming to the next question. The most cost-effective method of infection control in repeated disinfection use is what? Alcohol-based hand rub is repeated infection. Sorry, this is the question, that it is what? Repeated disinfectant use, or the hand washing, or the prophylactic antibiotic therapy, or the alcohol-based hand rubs. तो क्या रहेगा इसका आंसर? कि मोस्ट कॉस्ट इफेक्टिव दो चीजें हैं, एक तो कॉस्ट इफेक्टिव मेथड पूछा है फॉर द इन्फेक्शन कंट्रोल. नाउ प्रोफाइलेटिक एंटीबायोटिक थेरेपी इज नॉट मेथड ऑफ इन्फेक्शन कंट्रोल, क्योंकि अपन एंटीबायोटिक नहीं दे सकते, एंटीबायोटिक रेजिस्टेंस आ जाएगा. सो इट इज बेसिकली obviously it is not a method of control of infection. Now coming to the alcohol based hand rub and the repeated disinfectant use and the hand washing. Washing is the most effective and the most cost effective method for the infection control, because it can be done by anyone, and mostly in developing countries will not the major population will not go for the alcohol based rubbing to buy or the repeated disinfectant to use. यही नहीं पता होता क्या. So what is a cost effective method? It is what the hand washing. All right. So simple hand washing with a soap is recognized as a cost effective essential tool for achieving the good health and even good nutrition. All right. Now coming to the next question, that which of the following is the most common fungus, which is the most common fungus infection of the eye that is seen in the HIV positive patients is Aspergillus, Candida, Toxoplasma or Rhinosporidium. Now, what is the question is asking about the most common fungal infection? When we come to the options like Aspergillus, Candida, Toxoplasma, these all are the opportunistic infection that is taking place in HIV. But for the eye infection, the Toxoplasma gondii, it actually only infects about 1% of the patient with HIV that will infect the eye, and Aspergillus cause invasive endophthalmitis, but it is not that common because majorly it affects what? It affects the lung. So I, what is the most common? That is the fungus. That is what? The Candida. All right. Even if you doesn't know the answer, just go by that. We are talking about the eye, and in case अगर अपन किसी और चीज की बात करते हैं, like for the lung, it might be the Aspergillus, but the Candida is the most common infection that is taking place in the patient with the HIV. Now, most common fungal infection that is seen in the patient with the HIV is what? Candida albicans, and it is an important nosocomial pathogens, and it is the most common Candida species, that is what? The Candida albicans. All right, and it is commonly causing what? Keratitis, conjunctivitis, and endogenous fungal endophthalmitis. Now, coming to the next question, the serology profile is done for a patient is mentioned below. Which of the following is a likely cause of abnormal findings? That is, a HBS is what? Non-reactive, and HBV DNA is undetectable. HBE antigen is non-reactive, and IgG anti-HBC is reactive. It's chronic inactive state or chronic recovery state or pre-core mutant infection or the window period. So what will the answer here? Now, सबसे easy को सबसे पहले देखो that we are talking about the IgG anti-HPC that is reactive. So IgG that is having that is what mainly the chronic stage where the IgG क्योंकि window period में we do not see the antibodies in the serum of the patient. Now chronic we'll talk IgG, but the mostly it is what? It is majorly what? A chronic stage. That is either the chronic inactive stage or the chronic recovery stage of the patient. Now, next we see that also the HBV DNA is also non-detectable and the HBe antigen is also non-reactive and HBs antigen is also non-reactive. It is majorly present in which stage of the hepatitis in the recovery. All right. So from the given serology and the table given below, we just take a session for the hepatitis B as well to understand the serology of hepatitis B. Just the question answers we take down for the IMSS examination. For the most important topics that are frequently asked in the IMSS paper, just tracking down from the questions only, we'll take down the topics. Now, from the patient has had hepatitis B infections in the remote past and or is a low level of hepatitis B carrier. All right. So this graph is very important. This graph is very important. Please remember it by the heart, the graph that is important. Now coming to the next question. The following picture was seen in the nasal biopsy from a patient with a brain abscess. Identify the organism seen and the stain that is used is staph, streptococcus, gram stain, or the cryptococcus India ink or the nocardia gram stain. ठीक है वेरी सिंपल एक्चुअली सब कुछ स्लाइड में माइक्रोस्कोपी में यू कैन आइडेंटिफाई if it was staff was given if the staff was given they show what typical appearance of what cluster like grapes ठीक है and in the streptococcus they will be present in the chain and the cryptococcus they will be showing the capsule under what India in preparation. Gram stain is not majorly used for the cryptococcus क्योंकि the capsule doesn't take the stain, so we take the India ink or the nigrosin stain or the McFadden reaction that we do or the Quilling's reaction that we do for the capsule. It is what it is actually showing the filamentous growth. It is showing what the filamentous presentation and it is what it is nocardia. Also, the question is talking about the brain abscess. The staph and the streptococcus it doesn't have doesn't have the invasion into the brain. The clinical symptoms of the staph and the streptococcus doesn't actually have the symptoms that is presenting with the brain abscess or the involvement of the brain or the eye. So these two are not possible. Although the cryptococcus does have, but when we see this image that has been asked in the IMSS examination is not for the cryptococcus. Neither it is India in preparation. क्योंकि इंडिया इन प्रिपरेशन में बैकग्राउंड क्या होता है ब्लैक होता है ठीक है उसके ऊपर अपन को कैप्सूल दिखती हैं दैट इज वाइट कलर्ड हेलो रिफ्लेक्टाइल कैप्सूल्स आर सीन अगेंस्ट द ब्लैक बैकग्राउंड that is nocardia species showing the branching pleomorphic rods and what is stained with modified Zn staining. This is again the slides of the nocardia and another stain that we use is what in ion stain that is again to stain the acid fast bacteria. That is one is what we stain what mycobacteria, nocardia. And the cryptosporidium. This is important to remember the name of the stain, that is the quinine stain, to stain the acid fart species. Now this is what I was talking about, the Staphylococcus that is having the clusters or grapes like clusters, morphological appearance of the bacteria. This is a chain that is the Streptococcus. And this is what? This is the India ink preparation, or it is a negative stain. It is a negative stain, or we can also call it is what? Nigrosin stain, where the background is dark, black, and the capsule appear as the refractile white colored halo appearance around the bacteria, that fungus. All right. This is again the growth of the cryptococcus. This is also an important slide. This is also an important slide where we can see the capsule of the cryptococcus, because it is what it is, so showing the yeast-like organism, the budding growth of the cryptococcus under H and E stain. This is again the soap bubble appearance. This is also again important slide and important image of the cryptococcus that has been previously asked. Cryptococcus neoformans. Now जहाँ पे भी cryptococcus का question आएगा वहाँ पे you can clearly see the capsule. You can clearly see the capsule and the soap bubble appearance of the budding yeast. Now, coming to the next question, a smear was prepared from the genital ulcer. Identify the organism that is responsible. This image was given that it is chlamydia, it is Treponema pallidum, Trichomonas vaginalis, or Neisseria gonorrhea. So what will the answer here? That smear was prepared from the genital ulcers. Now some of you guys are saying that it is Treponema pallidum. Treponema pallidum कैसे हो सकता है? They show the corkscrew appearance. Corkscrew appearance. ठीक है, ऐसा होता है corkscrew appearance. It is what? It is the trophozoite form of the Trichomonas vaginalis. It is the trophozoite form of the Trichomonas vaginalis. All right. So two points that we need to remember is that Trichomonas vaginalis, the clinical presentation is what? The strawberry appearance of cervix and vagina. And what is the trophozoite? Is the only form, only one single form that is present in the life cycle of the Trichomonas vaginalis. And the motility is what we need to remember. It is about having the twitching or jerky motility. Okay. Now it is a flagellated protozoa, and it is the only stage that is present in the life cycle, as I told. And because there is only the trophozoite form, please remember there is only one form in the life cycle, because there is no cyst or no pre-cyst form. There is no cyst or no pre-cyst form. And the motility is very important to remember. It is showing what? Twitching or the jerky motility. All right, coming to sign and symptoms. Now it causes what? The inflammation of the vaginal canal with the tenderness, redness, and the very important with the yellow and green color foul smelling discharge. Third and most important point that we need to remember, it causes what? The strawberry cervix, also known as the Hepatitis macularis. Very important. Okay. Now, when we talk about the twitching motility or the jerking motility is mainly due to the one undulating membrane that is present in the trophozoite form. This is, you can see, the undulating membrane is attached with the trophozoite, and this is the membrane that is responsible for the twitching motility of the trophozoite. This trophozoite form. These are what you can see, the strawberry spots in the cervix. This is very important to remember. Key strawberry tongue, where we see that strawberry tongue, we see in the Kawasaki disease and the scarlet fever. Strawberry gingiva, we see in where Wagner's granulomatosis. Wagner's granulomatosis. Nasal mucosa, strawberry nasal mucosa in the sarcoidosis. Again, very important, strawberry nasal mass in the rhinosporidiosis. Strawberry, very important again, strawberry gallbladder is seen in a cholestrosis. Strawberry shaped skull is seen where in the Edward syndrome. Strawberry navius is again important question, is seen in the capillary hemangioma. And strawberry vagina and the cervix that we saw where trophozoite form, that is a trichomonas vaginalis. And the strawberry lesion of the rectosigmoid is seen in the Spirocheta vincenti and the Bacillus fusiform. In this, the strawberry tongue is important, ginger is important, nasal mask, gallbladder, nevus, vagina. All these are important questions to remember. Now, coming to the next question, a 24-year female presented with the ulcer in the genital area. Ginza stained cervical smear was taken, which showed the following image, identified the causative agent. It is chlamydia, Gardnerella vaginalis, H. ducreyi, or Calimobacterium donovani. So what is the answer in this case? Now, the coming to history, the question with the ulcer in the genital areas. Now, chlamydia, H. ducreyi, and the Gardnerella vaginalis, they all show the ulcer in the genital areas. But how do we identify the answer is by the cervical smear that has been shown to us in the question. This is actually the Donovani body that we see in the Calimotobacterium Donovani, that we see where in the Donovan bodies. All right. So, Coccobacilli that is seen in the gene sustained specimen suggests of the diagnosis of Granuloma inguinale. Granuloma inguinale, that is showing the Donovan bodies. Now, these Donovan bodies are different from that we see in the leishmaniasis. They are what? They are seen intracellularly in the mononuclear cells, and they are minute encapsulated cocobacilli. All right. Now it causes what? It causes what? The Calimobacterium has now been known as what? Klebsiella, causing what? Granuloma inguinale. And initial papules are on the genital, causing the ulcers and granulation tissues and the intense epithelial hyperplasia that can mimic the carcinoma. Alright, and we see what Donovan bodies, that is also we see in the leishmania, but the appearance is different when we see there. It is what? It is intracellular cocobacilli within vacuolated macrophage. All right. So, and in the leishmaniasis, it was actually the A mastigate form. A mastigate form that was taken by what? The macrophage, and that is forming what? There, the Donovan bodies. So two dominant bodies are different. The leishmaniasis, it is a amastigate form of the leishmania. Amastigate form that we remembered, A say A, that is आदमी में कौन सा form है amastigate, and the promastigate form is present in the fly, that is a vector that is transmitting the disease. So remember this, it is what? Intracellular cocobacilli within a vacuolated macrophage. Now, when we talk about the hemophilus, we talk about the appearance. We talk about the appearance that is important. One is what? One is the school of the fish appearance and the railroad track appearance. The name of this appearance is important. Please remember the school of the fish appearance and the railroad track appearance that is seen in the H influenza. Now, talking about the H. ducreyi, we see the soft ulcer. We see the soft ulcer or the chancroid. That is what? That is painful with regional adenopathy. That is, we are talking about a soft chancre that is caused by what? H. ducreyi. Now, coming to the investigations, these are actually what? The clue cells in the Gardnerella vaginalis. And what are clue cells? Clue cells are nothing but they are the accumulation of what? The bacteria over the epithelial cells, and the patient will present what? Foul smelling discharge. That is what they are. What? Clue cells, that is a vaginal epithelial cells that are that are coated with Gardnerella vaginalis, and we see the ulceration on the vaginal walls, and the media that we use is known what as the diamonds medium. Right? These are symptoms that the patient may present with a thin gray or the white vaginal discharge with peculiar consistency, and the fishy, smelly vaginal odor And the test we do is known as the whiff test. Is what the whiff test, जहाँ पे अपन क्या देखते हैं, we check out for the clue cells जो कि क्या होते हैं, जो कि epithelial cells में it is what? Accumulation of what? It is accumulation of the Gardnerella vaginalis, causing what? The bacterial vaginosis, and patient will present with fishy vaginal discharge with gray, white, or the green vaginal foul smelling discharge. The treatment of choice is what? Metronidazole. Is what? Metronidazole, 500 mg, 2 times a day for 7 days. Just remember, it is what? Metronidazole is what? The treatment of choice. Now, coming to the next question, a patient has presented with the headache and the projectile vomiting along with the alteration in the sensorium. The following parasite demonstrated on India in staining. What is the likely the diagnosis? So what we are seeing first, we are seeing what India ink preparation. That is a negative stain. That is the negative stain. ठीक है. What will the answer? It will be what? It will be what? Cryptococcus. Cryptococcus. Okay, अपन जो देख रहे हैं वो क्या है? Cryptococcus. That is the capsule we are seeing uh, in the India in preparation against the with the black background and the refractile capsule of the Cryptococcus. Histoplasma capsulatum is a misnomer because they are not capsulated. The only fungus that is capsulated is what? Cryptococcus neoforms. Now, blastomyces, the blastomyces is causing what? Causing what? Blastomycosis. Blastomycosis. जिसको अपन also it is known as the North American disease, and this shows the figure, very important figure of 8 appearance, and it is also known as the Gilchrist disease. Okay, so the diagram that is very important image that is we have covered of the cryptococcus, and very standard image of the cryptococcus, that when they are stained with the India in preparation, they will be showing what the refractile capsule against the dark background. All right, so alternate stains are the nigrosin and the musicarmin stain. They require the demonstration of the yeast cell, and the capsule that we see from the CSF that we take down, that is mixed with India ink, is a useful rapid diagnostic technique. Blastomycosis, I told you, blastomycosis is also known as the North American disease. North American disease or Gilchrist disease, that is having what? Figure of 8 appearance. The east is showing the budding appearance, that is of figure of 8 appearance. This is what the figure of 8 appearance, very important that we need to remember, is what? Gilchrist disease. Now, figure of 8 appearance is seen in the blastomycosis, in the coccidiomycosis. We see what? We see the Mickey Mouse appearance. Mickey Mouse appearance or Captain Wheel appearance. Captain Wheel appearance. For the C4C, that we see the Captain Wheel appearance or the Mickey Mouse appearance with barrel shape arthrospore, with barrel shape arthrospore. And what is the another name for the coccidomycosis is what? South and Central American disease, naming after the area where they are found. ठीक है, तो coccidomycosis में जो budding yeast होते हैं, they will show the Mickey Mouse appearance or the Captain Wheel appearance, and the arthrospores are what? Barrel shaped, and it is found in the South and the Central American. It is also known as the desert rheumatism or valley fever. All these are the alternative names, and we need to remember, these are important to remember. The valley fever or the C के बाद D, that is a desert rheumatism. C से C, that is a captain wheel appearance. C से पहले B, that is the barrel shaped arthrospore. Okay, so we can remember it as B, C, D, barrel shaped arthrospore, captain wheel appearance, desert rheumatism or valley fever. Now, coming to the next question, this is a schematic diagram depicting the body structure of which of the following helminthes: Onchocerca valvulus, Brugia malai, Loa loa, or Vicheria mancrofti. So this is what actually it is what the larva of the Charia born crafty having what the terminal and the subterminal nucleus having what the terminal and the subterminal nucleus. We'll also cover the larva forms of that all the important parasites. Now, coming to the next question, we need to cover the question soon because it's already past 1 hour. A patient presents with the progressive dyspnea. The chest X-ray revealed a cavitary lesion in the lower lobe of the right lung. The following histopathological appearance was seen of resection of the cavity, which is the most likely cause of the disease, and the number of layers that can be seen in the wall of the parasite. Again, very important question and a repetitive question from the same topic. Or the answer, whether it be cysticercosis with 3 layers, or the strongyloids with 2 layers, or the Echinococcus with 2 layers, or Paragonimus with 2 layers. Now, in the question, what is saying that the right lung is involved. Okay. One thing is that the lung involvement is taking place and the patient is present within the with the clinical symptoms of involvement of the lung, that is the dyspnea. And what is the most cause? It is the number of the layers that is has been asked and the parasite that has been asked. Okay. Now from the image that we see, we can see something like this, the cyst like appearance. Okay, in the that is present where in the lung. All right, and these cysts are what? These are what the high dated cyst. High dated cyst, ठीक है. And उनके layers होते हैं that we read about the layers that are around the high dated cyst and the brood capsules and the scoliosis. All right, so this is what this is actually high dated cyst. High dated cyst with two layers. One layer is of the fibrous reactions that is seen in the lung due to the implantation of the hydatid cyst, and the another layer is what the germinal layer. So it is what it is by what the echinococcus where the hydatid cysts are seen. That is one is what the germinal epithelium. All right, and the another layer is what the cyst wall, and it is consisting of what the fibrous reactions around the cyst. That is one is what the fibrous capsule, the fibrous cyst wall that is present, and another is what the germinal layer. So two layers are present and it is consisting of what daughter cyst, it is consisting of the protoscolix and the brood capsules and the high dated fluid. So this is the important image and we need to remember this. Okay, this is the brood capsule and these are the daughter cysts. These are the daughter cysts that are freely floating in where? In the hydrated fluid, and that is the hydrated sand that is the freely floating, that is the floating in the hydrated sand. Now, what is the name of the disease that is transmitted by the vector? That is filaria, leishmaniasis, yellow fever, or malaria. So what is the name of the disease that is transmitted by this vector? Vector कौन सा? Vector is what? Vector is what? Sandfly. And sandfly what causes? It causes what? Leishmaniasis. It causes the leishmaniasis. Alright. And what are the reservoir for the leishmaniasis? They are what? Mammals, rodents, dogs, and bulls. Alright. And what is the infective stage? What is the infective stage? What is the infective stage? What is the infective stage is what? Pro-mastigate form. Pro-mastigate form. Alright, and humans में कौन सा अपन को form मिलता है? That is the A-mastigate form. A-mastigate form. And how we remember that आदमी में is what? We are getting what? The A-mastigate form, and they are taken by what? They are taken by what? Macrophage. They are taken by what? Macrophage, and this leads to what? LD bodies. LD bodies, that is Leishmania, Donovan bodies. All right. So, sandfly, that is the primary vector of the leishmaniasis and hepatitis fever, and the oval lancet wings are carried erect in the humped adults. The oval lancet wings are carried erect on the humped thorax. Now, this is very important. The important vector-borne disease that in the malaria, it is what Anopheles. In the dengue, it is what Aedes. In the chikungunya, it is also Aedes aegypti and the albopictus, and the Japanese encephalitis, that is the Culex. Alright, Kala Azar, that is what we're talking about leishmania, that is what sandfly, and for the filariasis, it is what Culex and Mansonium. These are what? These are the LD bodies, and these are the amasticate form that is present inside what? Present inside the macrophage, that is what? LD bodies. Now identify the disease in which of the following treatment is used in the influenza, Kala Azar, TB, or leprosy. These strips are particularly used. These strips are particularly used where used in the leprosy, and we need to remember the type of the color coding for the leprosy that is given. So please remember for the adults specifically that for the possibacillary adult regime, it is what you can see the capsule one, three capsules that are present over the head. These two capsules. These two capsules are what? Of rifampicin, and in between one capsule is given, in between one is given, that is a tablet of what? Dapsone. Similarly, here in the multibacillary adult blister pack, you can see this one white color capsule. This is what? One tablet for that of the Dapsone. And the three tablets are above this are what? Rifampicin. The two are below this are what? For the clofazimine. All right, and below that you can see one white capsule. This is what for the same, that is the dapsone. So in the PB adult regime, we are giving what? Rifampicin and dapsone. And for the once a month, that is on the day one, what the patient has to take, it has to take 2 hours and 1 day. Okay, that is 2 rifampicin and one tablet of dapsone, that is followed by the day 2 by one tablet of the dapsone every day. All right, and similarly for the MB, we are for the multibacillary, we are giving the three tablets that are above are what? For the rifampicin, below two tablets for the clofazimine, and the one white tablet that is for dapsone. And below that is what one tablet of the dapsone and with one tablet of the clofazimine. The color coding is important for the leprosy, and it is again a repetitive question. So please remember this. Now, come to the next question. The following life cycle most closely resembles that which of the following viruses? Which of the following virus? It is influenza or the dengue or the Japanese encephalitis or the KFD. Very simple question that has been asked in the IMSS examination. This is about Japanese encephalitis. Now, in the question, one is given about the dead end host, that humans are the not the host for the disease, and another is the most important thing is the amplifying host. Remember it by heart that pigs are what? Pigs are the amplifying host for Japanese encephalitis, and the maintenance host are what? Birds. All right. Japanese encephalitis, it is clear for the given diagram that the life cycle is of Japanese encephalitis. Humans are the dead end host and they are what? Incidental host. They are what? Incidental host. The viruses, mosquito transmits mainly the virus to the birds and the cattle, and the virus, the pigs are what? The amplifying host. Very important, the pigs are the amplifying host. Okay? Now humans are the dead end host and the incidental host for the Japanese encephalitis. Now coming to the next question. This is the last question of today's session. That a young male, he presents with the following itchy lesion for 1 month, and all of the following genera can cause this kind of lesion except the aspergillus or the trichophyton microsporum and the epidermophyton. All right, so what is this? Please remember that the image that has been shown is of jag itch. Jag itch. Although it mainly occurs where in the groin region, it occurs mainly in the groin region, and the trichophyton microsporum and the epidermophytons, the dermatophytes are the cause for the jag itch, but not aspergillus. The lesion in the given picture are suggestive of the tinea, and it is known as what? Jag itch, and dermatophytosis of the groin region caused by usually the trichophyton rubrum. Alright, group of fungus or the ringworm that under moist conditions have the ability to infect and survive only on the dead keratin, that is the superficial topmost layer of the skin, hair and nails, and the image that is shown is what? Of the tinea, and showing the jag itch belonging to mainly which category? That is the microsporum, epidermophyton and the trichophyton, but not the aspergillus. Aspergillus mainly causes what? It is what? It is typically an immunocompetent. One point is very important, that it causes what? in the immunosuppressed person. Now, allergic aspergillus sinusitis and allergic bronchopulmonary aspergillosis. Now, in patients with the chronic illness, we see what fungus ball in the pre-existing cavities of the patient with invasive aspergillosis, which is having the high mortality rate. This is Jackie as I talk, the treatment tips that can be given. This is taking a shower regularly with the keeping your groin air clean and dry. These are the home tips that can be done for the jack itch. Other than this, the treatment for the dermatophyte. All right, so this was about the today's session. In a very rapid phase, we actually covered the question answer round, and just after the question answer round, we'll take the high yield topics that has been asked previously in the INICET exam and the AIMS examination, Central Institute examination, covering the high yield topics that has been previously asked. And please do use my code, that is Muskan 10, to get 10% of the discount, and do like, share and subscribe, and use my code, that is Muskan 10, to enroll into the Unacademy and to enroll into the subscription. On the 10th of October at 11 a.m. we are having what? We are having the NEET PG Compact. We are having the NEET PG Compact, where it is a scholarship program. It is a scholarship program by what? Unacademy, that is having 60-minute paper with 45 questions, and the first to third ranker will get the plus subscriptions totally free, and depending upon the rank, the 75%, 50% and 25% of the scholarship. So I'll see you again tomorrow. So thank you so much, and I will just see you tomorrow, and we'll cover. This was the paper that has been taken down from the year 15 and 16 until we reach 2020. We'll do the question answers, and in one lecture, two question papers are included. Like in today's 15 and 16 AIMS examination paper was included. Theory ज़्यादा I do not cover in such sessions because it clearly the examination is over the head, and I'll just cover the question answers mainly, so you can get to know the important topics and you can revise those topics. Once we are done with the question answers, we'll do the theory part. All right, so take care and have a good sleep. So पढ़ो और अच्छे से सो, and don't worry, don't take tension, just carry on with your studies. Patience is the key for the success in the competitive exams. Constant study and the consistency is something that is the topmost needed for any competitive exam. The person who is truly intelligent and very intelligent may not be able to crack the examination, but the person who is consistent with his study and an average student will surely go through the examination easily. All right, so have patience, and these are your testing days. Do not lose your patience and the hope everything will end up well, and already you have reached very far. जो 5% of the people generally reach up to this stage after completing MBBS, or who are in the MBBS, you are already the cream of India, and getting through the PG success, examination, you will be, I guess, super cream for the India. All right, so don't think that you are just have done MBBS. And doing MBBS is something that is not possible for every person. Just 4 to 5% people can get through the MBBS and can be the doctor. You have the privilege. You are already being already you are a doctor, and you don't need anything now to prove yourself to society. Just don't take the pressure so much on your mind. Easily पढ़ोगे तो अच्छे से पढ़ाई होगी, and easily paper go through हो जाएगा. फिर stress लेके पढ़ोगे तो it will be very difficult, and anxiety and panic you will getting through it, and don't study under stress at least. All right, so see you then tomorrow. कल मिलते हैं. Take care and bye bye.